Welcome back to the Deep Dive. Today we are tackling a topic that is just incredibly common but so frustrating for so many people. We're talking about hyperpigmentation.
Right. We're talking about those dark spots, the patches. They can be brown, gray, sometimes even a bit blue-black that just seem to stick around forever.
Exactly. And the definition itself is pretty simple, right? It's just an overproduction of melanin in the skin.
It is, but the impact is anything but simple.
That's really the core of what our sources were getting at. Physically, hyperpigmentation is harmless. It's not a dangerous health concern, but because it's so visible, it can cause real, measurable emotional distress. Things like low self-esteem, anxiety. It carries a huge psychological weight.
Absolutely. So our mission for this deep dive is to give you a kind of shortcut to understanding the science behind it.
What are the triggers?
Triggers, yeah. How sun, hormones, and inflammation all play together. And then we want to build out the definitive treatment toolkit.
Showing you where, prevention really meets those clinical results. We're aiming for informed management.
Not just definitions.
Okay, so let's get into that core mechanism. We hear the word melanin all the time, but how does the skin actually create these spots? What's happening on a cellular level?
It's basically the skin's defense system going into overdrive.
Okay.
Melanin is the pigment that gives our skin, hair, and eyes their color. And hyperpigmentation happens when these specialized cells, they're called melanocytes, decide to just dump an excessive amount of this melanin into a specific area.
So they're targeting one spot.
Exactly. And what's really fascinating here is that this is usually a protective response. The skin senses a stressor.
What kind of stressor?
It could be an injury, it could be a big hormonal shift, but most often it's ultraviolet radiation from the sun. The skin basically manufactures melanin as a biological shield.
So if the skin is stressed, it throws up a shield. That makes perfect sense. Our sources laid out about 7 primary stressors that kick off this whole reaction. When you look at that list, it's everything from aging and genetics to certain drugs. Which one is the most significant?
Oh, that's easy. The overwhelming factor, the one that makes every other cause worse, is UV exposure. It's the sun.
Right.
Sun damage directly tells the skin to make melanin, which gives us sunspots. But here's the crucial insight. Sun protection isn't just about preventing new spots.
It's about managing the existing ones, too.
It's the only way to stop triggers like hormones and inflammation from accelerating and darkening the spots you already have. If you have melasma from hormones and you skip the SPF, it's like pouring gasoline on a fire.
Wow. That interaction is so key. And we also have to touch on the genetic component because individuals with darker skin tones, they naturally have more active melanocytes.
Correct, which means they face a higher risk, especially when it comes to any kind of post-inflammatory issue.
And out of all of them, which trigger do you think is the least understood by, the average person?
I would argue it's inflammation. People get the sunscreen part, but they don't realize that picking at an acne spot or even treating eczema too aggressively is a direct instruction to those melanocytes.
It's a signal.
That's a signal that says, produce pigment right here.
That leads us perfectly into the different types, the different patterns of discoloration. Because knowing the trigger helps you figure out the best way to treat it.
Exactly. We basically have 3 main buckets: age spots, melasma, and post-inflammatory hyperpigmentation.
Okay.
They all look different, and they each tell a story about what caused them.
Let's start with age spots, also called solar lentigines. What are the calling cards for this type?
Okay, so these are typically flat, oval patches. They can be tan, dark brown, and they're usually pretty small, just a few millimeters to maybe a couple of centimeters.
And the cause is just sun.
It's purely cumulative UV exposure over a lifetime. It leads to this uneven melanin buildup. You find them where the sun hits the hardest: backs of the hands, the face, the shoulders.
And we have to clarify a myth we pulled from the research. People call them liver spots.
Right, a complete misnomer.
They have absolutely zero connection to your liver function.
An old name that really needs to be retired. Now, the second type, melasma, is dramatically different.
This is the mask of pregnancy, right?
Yes. This is that symmetrical, larger, patchy discoloration. It can be dark brown, grayish-brown, and it often develops symmetrically across the face.
Like on the cheekbones, forehead, upper lip.
Exactly. And the primary trigger here is hormonal. Pregnancy, birth control pills, general endocrine shifts. Which is why it overwhelmingly affects women.
And so the hormones are like a fertilizer for the pigment cells.
A perfect analogy. They make the melanocytes hyper-responsive. And then the moment that skin sees the sun, the pigmentation gets darker almost instantly.
Okay, and finally, the type that probably causes the most long-term distress, post-inflammatory hyperpigmentation, or PIH.
Yeah, this is the dark mark that's left after any kind of skin trauma.
Like acne.
Acne, eczema, a burn, a cut, even an aggressive cosmetic procedure. The discolored patch basically mirrors the size and shape of that original injury.
And this is where we have to talk about depth. This was a key insight from the sources. Why does the depth of the pigment determine if it fades in 6 months or sticks around for 6 years?
This is so crucial for you to understand. If you have what's called epidermal PIH, the pigment is sitting in the top layers of your skin.
The epidermis.
Right. So this can be managed relatively quickly, maybe 6 to 12 months, because your skin naturally sheds those cells, and topical products can help speed that up.
But dermal PIH is another story.
A completely different beast. Here, the pigment is lodged deep down in the dermis, the lower layer of skin. It's trapped.
So your body can't clear it out easily.
Exactly. And that's why dermal PIH can persist for years. It's also why standard peels or lightening creams often don't work on it. You need something more targeted, like a laser.
That is a phenomenal distinction. It tells you immediately why some of your dark spots might seem absolutely impossible to get rid of.
If the spot looks kind of bluish or grayish, that's a strong sign the pigment is deeper, and it's going to be much harder to treat.
Let's pivot now to the bigger health picture. Is hyperpigmentation ever a sign that something else is going on systemically?
Yes, absolutely. While most cases are, superficial and cosmetic, sometimes it can be a visual clue to a deeper problem or even a side effect of medication.
What are the red flags we should be looking out for?
Well, the sources often point to two specific health conditions. One is Addison's disease. It's an endocrine disorder.
Okay.
The hormonal imbalance from the adrenal glands can cause this widespread darkening of the skin. The second one is diabetes. Chronic high blood sugar and fluctuating insulin can trigger pigment changes.
So if you notice new widespread darkening, especially if it's paired with other symptoms like fatigue or dizziness, that's a signal to see a doctor, not just a dermatologist.
Precisely. And we can't forget the medications we mentioned earlier. Certain drugs, antibiotics, anti-seizure meds, even things like NSAIDs can make your skin highly photosensitive.
So they don't cause the spots directly?
No, but they make you exponentially more likely to develop them when you're exposed to UV light. It's a key thing to be aware of.
What about delaying treatment? If someone just ignores the spots, what's the risk beyond that years-long battle with dermal PIH?
The physical risk is permanence. When it's left untreated and the trigger isn't addressed, like you're still getting too much sun, the pigment gets really deeply ingrained.
It sinks deeper.
It sinks into that dermal layer, and then it's just so much more difficult and expensive to remove.
And we keep coming back to the psychological factor.
Which is paramount. The sources really stress this. Timely intervention doesn't just lighten the spots. It prevents years of emotional distress and anxiety. It really improves quality of life.
So let's shift to proactive steps.
Yeah.
Prevention and treatment. If we agree prevention is non-negotiable, what are the key steps beyond just sunscreen?
Okay, so sunscreen is the foundation. SPF 30, broad spectrum, every single day, no exceptions. But let's add the other four. First, you have to prioritize inflammation control.
For the PIH.
Yes. PIH management is 80% controlling the acne or the irritation, and only 20% lightening the mark. Do not pick or scratch. That's a direct trigger.
That's a huge mental shift. Treat the breakout, not just the mark it leaves behind.
Exactly. Second is physical protection. Wide-brimmed hats, protective clothing, seeking shade during those peak sun hours, 10 to 2.
You can't just rely on sunscreen.
You can. Physical barriers are better. Third is skincare actives. Start using ingredients that actively inhibit melanin, like vitamin C or niacinamide.
And the final step?
Professional guidance. This can be a real trial and error process, and a professional can tell you if you're dealing with epidermal or dermal pigment, which can save you years of frustration.
Okay, now for active treatment. Let's talk topicals. Vitamin C seems to be the hero product here. Why is it so versatile?
Vitamin C is exceptional. It does 3 things at once. It's an antioxidant, so it protects from UV damage. It lightens existing pigment. And crucially, it actively decreases the enzyme tyrosinase that's needed to create melanin in the first place.
So for anyone looking at labels, what should they look for?
The sources are specific, L-ascorbic acid, and you want a robust concentration, ideally between 10 and 20% for it to be really effective.
What about the other heavy hitters, like retinoids and hydroquinone?
Retinoids are the long-term game changers. They dramatically speed up cell turnover, which helps shed those pigmented cells faster.
So they take that 12-month fade down to 6 months.
Potentially, for epidermal PIH, yes. Then you have hydroquinone. It's the most powerful lightening agent out there. It directly reduces melanin production, but
Hit patch.
there is. Its use is highly regulated because of risks with long-term use. It should only be used in short bursts, like 8 to 12 weeks under professional supervision. It's a tool for quick intervention, not daily maintenance.
And if topicals aren't cutting it, or we're fighting that stubborn dermal pigment, that's when the professional procedures come in.
Right. The dermal pigment, you often have to physically break down that trapped melanin, so we're talking about laser therapy. We also have chemical peels, which use higher strength acids to remove outer skin layers. And for age spots specifically, cryotherapy, basically freezing the spots, can be very effective.
Let's put this all together into an ideal daily routine for someone managing this.
Okay. In the evening, you cleanse, maybe with a gentle AHA cleanser. Then apply your treatment serums, your retinoid or other lighteners. Then moisturize to repair your skin barrier.
And then in the morning,
You cleanse, apply your vitamin C serum for that antioxidant shield, moisturize again, and then finally, sunscreen, SPF 30 or higher. And you have to reapply. That consistency is the only way you'll see real lasting results.
this has been a truly enlightening deep dive. I feel like we've moved past just defining the problem and into really actionable management.
I hope so.
So to wrap it up, the two biggest takeaways are sun exposure is the #1 trigger for all types of hyperpigmentation. And daily, consistent, broad-spectrum SPF is completely non-negotiable.
And we have to reiterate the medical context. 99% of dark spots are benign, but if you notice spots that are rapidly changing, size, color, shape, you need to see a professional to rule out something more serious.
That is critical context to always keep in mind.
And I want to leave you with one final thought, building on how severe post-inflammatory hyperpigmentation can be. Since PIH is often the most stubborn type, with dermal spots potentially taking years to resolve, the best path is always prevention. So knowing that skin trauma and inflammation are major triggers, my question to you is this. How much do you truly monitor and protect yourself from minor inflammation, not just the sun in your daily life? Are you proactively controlling the initial irritation, or are you just dealing with the long-term fallout? Think about that commitment to prevention today.